Hello everyone, my name is Dr. Bob DeMaria with another week in health, and we have some really hot news this week in reference to a food. It's called trans fat, and way back in 2005 I wrote a book called Dr. Bob's Trans Fat Survival Guide. Back in the mid-1990s, the nurse study was released in reference to information about trans fat. But the articles I'm talking about today is the FDA to ban trans fat. This is by Mary Clark Jelinek, and that was from the AP Press. And then the Wall Street Journal also had an article this week, Regulators Move to Ban Trans Fat. That was on Friday, November the 8th, and the other one was on November the 7th. Both articles have a lot of very interesting information. The amount of trans fat consumption has been reducing in the United States the last couple of years, and that really is very good news. My concern is, first, trans fat has been around for over 30 years, and I want to talk to you a little bit now about science. Way back in 1998, the nurses study was released, and the nurses study said that if a nurse, which is a part of the study, would consume 1 gram of trans fat or more per day, they would increase their chances of having heart disease by 20%. Well, back in 2005 and 6, the FDA had this rule that came out that said if a product had 1/2 gram of trans fat or less per serving, they could say 0 grams trans fat. Now, these rules, according to this article, are not necessarily, or this change is not necessarily going to happen for a year or two. So I'm going to encourage you to avoid trans fat, which is also known as partially hydrogenated oils. Partially hydrogenated oils, or trans fat, wreaks havoc not only in your cardiovascular system, but I know some of you right now are suffering with depression, anxiety, even contemplating ADHD and dementia. Trans fat sabotages your body's ability to make good fat that takes away pain and takes away inflammation. So trans fat has been bad for the last 30 years. Translating this a little bit more as far as a substitute for trans fatty acids, I've done research and actually just finished a radio program on the fan that somebody called in and said, Dr. Bob, what about soybean oil? That they use hexane to take the oil out of the beans. And another oil that's really a popular oil is canola oil. So a part of this information for you this week is educational also. Probably the healthiest oil for each and every one of you to use to saute your foods with would be olive oil. And I know there's controversy even over coconut oil. Coconut oil itself is not necessarily going to raise your cholesterol level. Coconut oil comes from a plant source. These articles from both the Wall Street Journal and the AP were excellent articles. They're giving us information about what trans fat is doing and has been doing in the last several decades in the United States and across the world. Finally, my last concern was this. FDA never said trans fat was safe. So the food manufacturers took that and ran with it. There are so many other items that I just want you to be aware of. I would minimize or eliminate all artificial foods. My name is Dr. Bob DeMaria, the Drugless Doctor.